ఇండో యుఎస్ సూపర్ స్పెషాలిటీ హాస్పిటల్ అమీర్పేట హైదరాబాద్ అత్యాధునిక సౌకర్యాలతో అపారమైన అనుభవం కలిగి సుశిక్షితులైన వైద్య బృందంచే జనరల్ చికిత్సలు శస్త్రచికిత్సలు అందిస్తూ ఉన్నత శ్రేణి ప్రమాణాలు సౌకర్యాలు కలిగి సామాన్య మధ్యతరగతి వారికి కూడా అంకిత భావంతో వైద్య సేవలు అందిస్తుంది ఇండో యుఎస్ సూపర్ స్పెషాలిటీ హాస్పిటల్. లేటెస్ట్ టెక్నాలజీతో కూడిన ల్యాబ్లు, ఆపరేషన్ థియేటర్లు కలిగి అన్ని వ్యాధులకు అన్ని వైద్య విభాగాలు కలిగి పేరు ప్రఖ్యాతులు కలిగిన హాస్పిటల్ ఇండో యుఎస్ సూపర్ స్పెషాలిటీ హాస్పిటల్.
Namaste. On behalf of Chairperson Usharani Manne and her committee, I, Priya Gasdar, Honorary Secretary, welcome you to this afternoon's Knowledge Lab session, Check the Change. I used to be the proverbial ostrich, putting my head in the sand and pretending nothing was wrong. It was my best friend who persuaded me to get medical advice when I casually spoke about noticing a small lump in my breast. She just nagged and nagged and nagged. So I went just to shut her up. I didn't for a moment think it was going to be the big C. I was healthy, had breastfed my kids. I didn't smoke or drink. My mom had had breast cancer in the past, but we never talked about it. And I honestly didn't think it was going to happen to me. I am so glad my friend persuaded me to get help when she did. I am still here today for my family. And while it did take some time and doing, life is getting back to normal. In hindsight, I would have done everything differently and gone to the doctor sooner. But I can tell you from this experience that you do need to speak up and get attention. Do not be the ostrich that I was. This is a friend's take on her personal blog, and I think it's advice that all of us need to take seriously, very seriously. Whether it's a personal diagnosis or that of a loved one finding answers to your questions, and a supportive community of people who understand the experience, who can make all the difference. From today's talk, we hope to spark that realization and conversation, not only for ourselves, but for all those who love us. I now invite Chairperson Usharani Manne to light the ceremonial lamp and deliver her welcome address.
Dear Dr. Pragnya Chigurupati, past aides, viewers, and FLO members, Namaste. I would like to take this opportunity to wish you all a very happy and healthy festive season. Even as we all pray to be delivered safely out of this year of the pandemic, there is one disease that has been a cause for concern for millions of our gender across the world. This disease knows no boundaries, knows no borders. It's agnostic to race, age, and it certainly doesn't care for socio-economic status. It is estimated that 1 in every 28 women will be diagnosed with breast cancer during her lifetime. Survival rate in India is about 60%, a lot lesser than some other countries such as USA. And this is not merely because of a lack of accessibility to medical infrastructure, but because of a lack of awareness in the first place. Alarming as they are, what do these numbers really mean? It means 1 in 28 families will confront a crisis this year. 1 in 28 families will be subjected to the fear that they may lose a mother, a sister, a daughter, or a dear friend, and 60% of them will see that fear will become a reality. This Breast Cancer Awareness Month, let's encourage ourselves and the women in our lives, our mothers, our sisters, our daughters, friends, and those who work for us to get a mammogram. Early detection saves lives. Let's work together to make stories of survivors, the story for every woman diagnosed with breast cancer. Over the next 3 days, please wear pink, make a photo or a video, post your thoughts on breast cancer awareness, post it on your social media handles, and tag FLO Hyderabad, Vicky Flow, and One Flow. Let's participate in this very important global conversation. Moving on, my dear friends, your chapter has taken long strides in the social outreach programs. 60 women farmers were trained in the manufacture of organic pesticides at Saidalpet village in Vikarabad district. My thanks to FLO member Sujini Dundu for sponsoring the training, and to Radharani and Sita Reddy for all the coordination and mobilization. 240 women successfully completed their training on how to start a new business, conducted by Sleepwell Foundation. Thank you, Radharani, our EC head, and the EC member Prashanti Shekhar for mobilizing the candidates and made it possible. The IIIT Hyderabad boot camp was attended by 15 members, of who 6 were shortlisted for the micro accelerator camp, the one-on-one mentoring under which is going on as we speak. The pitch day has been fixed for 10th November, wherein the 6 of them will be pitching their business proposals to a panel of VCs and angel investors. All the best to all the 6. Thank you, Nanda Maganti and Sarita Chilkapati, for making it happen. Our tie-up with McLean Group, facilitators of DDU GKY program of Government of India, has taken shape. We were able to mobilize close to 50 youth, of who 28 are women, for their technical certificate programs that started today. Thanks to our Honorary Secretary Priya Gasdar for this mobilization and coordination. You are already aware that on 30th of this month, we are presenting the second in our Game Changer series, True North, with our dear past chairs, Monica Agarwal and Rekha Lahoti. It's going to be a very exciting session, so please do be there. India's water power is mighty, but unless harnessed and used properly, it cannot go to waste. In our next Power Hour, Jalasya Rakshanam, we will have Sri Gajendra Singh Shekhawat of the Jal Shakti Ministry Abhiyan with us. Mark your calendar for the 9th of November. Our speaker today is a young breast cancer surgeon and consultant working with renowned American Oncology Institute. Thank you, Dr. Pragnya Chigurupati, for joining us here this afternoon. I'm hopeful that your talk and exhortations will spur us into action and push us to take our annual health checkups more seriously. Before you start, over to Priya for introducing you to our audience. Thank you.
Thank you, Usha. Dr. Pragnya Chigurupati is an oncoplastic surgeon and breast oncology consultant, currently affiliated to American Oncology Institute at Hyderabad. She holds an MS in General Surgery, MRCS from Edinburgh, Fellowship in HBNI Breast Oncology from Tata Memorial Hospital, and UHNM Breast Oncoplastic Fellowship from RSUH, UK. Her areas of expertise encompass benign and malignant breast diseases, conservative surgery, corrective and reconstructive procedures, and diagnostic procedures. In her spare time, if any, she loves to indulge in her passion for planning themed events for family and friends, trying a hand at new recipes, and painting. I invite you to take the stage, Dr. Pragnya. Viewers, please leave your questions for our speaker in the chat boxes on Zoom, FB, and YouTube. We will be taking them up in the Q&A session after the talk. As requested earlier, please turn off your audio-video feed through the duration of the talk. Over to you, Doctor.
Thank you, Ms. Priya. Thank you, Ms. Usha. I'm extremely happy to be here, especially because on the other end of the table, I've literally grown up with half of you. I'm extremely delighted to be here today to, use this as a platform to spread awareness on a topic which is so close to my heart for personal reasons as well. As Ms. Usha has already mentioned, October is Breast Cancer Awareness Month, and she's already given the statistics out, so I'm glad it's out there. But besides just talking about breast cancer as such, I'm also going to mention a few other issues of the breast today. Hope this helps you, and you can ask me any question at the end of the talk. So I'm just gonna share my screen. Perfect. Can everyone see this?
Yes.
Yes, we can.
Perfect. Okay. Hi, everyone. Like I was introduced, I'm Dr. Pragnya Chigurupati. I'm a consultant breast oncologist and an oncoplastic surgeon. I'm currently working at American Oncology Institute, Hyderabad. To begin with, before I get onto the breast cancer aspects of it, what you should also know is that every breast lump that a woman develops is not cancerous. Around 8 to 10 lumps are actually benign, which means not cancerous. All the breast symptoms, which include breast pain, nipple discharge, nipple retraction, skin thickening, any skin changes, swelling elsewhere, change in the shape of the breast, they can be either malignant or benign. So if you have any symptom, do not just while it away saying it's benign, it could be cancerous. And if you ever develop a lump and you get a biopsy and they say it's a benign lump, be aware because few of these benign lumps may turn cancerous over a period of time. Cancers or precancerous lumps or diseases do not always present as a lump. All the symptoms that I've just mentioned above may be just the predecessors to precancerous or cancerous lumps. You do not always have to lose your breast if diagnosed with breast cancer. With the recent advances, there's so many things that you can do which would improve a person's quality of life. Breast cancer as such is curable if it's detected early. So do not panic, and at the same time, do not ignore any of these symptoms, especially a woman about the age of 40. So just to mention a quick word on the incidence of breast cancer. According to the Globocon data in 2018, breast cancer is one of the most common types of cancers, and it attributes to around 24.2% worldwide amongst the women, followed by colorectal cancers, which is 9.5%. So there's a huge difference between breast and colorectal cancers right there. And when it comes to mortality from breast cancer, it's around 15%, which is again quite high. Most of them are unfortunately attributed to the underdeveloped or the developing countries compared to the developed countries. In 2018, which amongst between both the sexes, men and women, were around 14% when it comes to breast cancer alone, whereas in 2018, amongst all the females, 27.7% were attributed to breast cancer alone, which is a staggering high number. And this is the data according to 2018 Globocon. 2020, the most recent statistics in India show that there is an increasing number of patients between the age group of 25 and 40. And this is definitely a disturbing trend. If you look at this graph, the bars in the blue are 25 years ago, and the bars in red are the current stats. And the x-axis are the age groups. So if you look at 20 to 30 and 30 to 40, you can see a huge jump from 25 years ago to the current situation. And the same even between 40 and 50. So why does this jump occur? Why has this happened? I'll mention it to you in the next couple of slides. The incidence in India currently, as Mrs. Usha, 8 women. looking at the numbers as such, you might think, okay, fine, we're at a better stage, but absolutely not. The total number of patients who present to us in the advanced cases or the metastatic cases. Metastatic is basically when you present with a cancer which is already spread to different parts of the body. Nearly 50% of them present to us with the advanced cases or the metastatic cases, and 50 to 55 are early breast cancers, which makes a huge difference when you put things in perspective. The alarming changes. Back in the day, before 2008, cervical cancer was the most common cancer in India amongst the women. In 2008, breast cancer overtook in urban India, but not rural India. Whereas in 2012, there was a huge leap. Breast cancer now is the most common type of cancer in both urban as well as rural India. So if you look at the recent data, breast cancer as such is 25 to 32%, whereas cervical cancer is 8 to 9%. And this is again a huge gap. Why did this happen? One, the main reason is because HPV vaccine is available for cervical cancer. That does protect the young girl against cervical cancer. And unfortunately, there is no vaccine available for breast cancer at this moment in time. And the only tool that will help prevent or detect early breast cancers is self-awareness and breast self-examination besides mammography. Again, like it was mentioned earlier, the survival rates are improving across the world. And in the US, it's approximately around 90 to 95% for early breast cancer. However, in India, it's only 60%. Why? 30 to 35% are locally advanced at the time of presentation. So the common symptoms that we can have in the breast, the pictures might be slightly disturbing. I hope they don't really scare you away. So the most common symptoms are breast pain. Now, every one of us have experienced breast pain at some point or the other through our lifetime. It could be cyclical, which is associated with the menstrual cycle, or non-cyclical, which is not associated with the menstrual cycle. It could be radiating from the shoulder, the chest bone, or the underlying muscles, especially when women work out, etc. The breast lumps, of course, the most common complaint in women are breast lumps. Nipple discharge, it could be mucky, which could mean infection, yellowish, green, bloody, clear. Nipple inversion. So you have to understand how your nipples look like from a very young age. So you understand when it actually inverts and new symptoms or signs arise in the breast. Itching or crusting of the nipple. Now, most of the women who breastfeed, of course, do have symptoms of itching and cracking, crusting of the nipple, which generally should settle with moisturizers or low-dose steroids. But sometimes this is not settled with some simple conservative management. It might lead to something called eczema, or it might lead to other conditions which are known as Paget's disease, which may or may not have an underlying cancer. I'll describe what Paget's disease is in a bit. The other symptoms are skin changes, such as infections, which basically look like in the picture. The entire breast can become hot, warm, red, and it looks massive. And this could also be a sign of cancer. And the picture on the right is the most common fungal infection that occurs in the undersurface of the breast. And this is known as intertrigo, which it has a simple treatment to it, which is just basically keeping the area dry and hygiene. The other symptom is change in the size or the shape of the breast. So before you know what these symptoms and signs are in your body, the most important thing is knowing your breast, being aware of how your breast looks like from the time you start examining your breast. So breast cancer, what are the risk factors? They could be non-modifiable or they are modifiable. Now, obviously, you can't really do anything about the non-modifiable factors such as age, gender, family history, length of the reproductive life, and others such as ethnicity, benign breast conditions, or previous chest irradiation. And those which are in our hands to modify are hormonal factors such as reproductive characteristics, exogenous hormones, or lifestyle factors. Risk factors. As a woman gets older, especially about the age of 40, the chances of her getting breast cancer during her lifetime jumps from 1 in 258 to 1 in 67. And obviously, females are more prone to breast cancer compared to men. Having said that, men do account for 1% of all the breast cancers. Family history. Now, when patients come to me, I generally tend to ask them, why do you think you had breast cancer? And most of them end up saying, maybe someone in my family had it. But what you should know is that it's only 5 to 10% of all the breast cancers which are actually familial or they're hereditary. The rest of them are because of all the other factors that were mentioned before, which are known as sporadic. So what basically is family history is, if you know any member in your family with breast cancer, ovarian cancer, and other kinds of cancers such as pancreatic cancer, prostate cancer, some skin cancer such as melanoma, make sure that you understand what age this person was diagnosed with the cancer, what exactly happened to them, what treatment they underwent, and what is their current situation. It's especially in your blood-related relatives rather than your mother-in-law or father-in-law. There's no connection over there. So if you think you have a family history of breast or ovarian cancer, there are professional genetic counselors you can reach out to who would make your family tree, like the picture on the right, and then suggest if you should go through genetic tests or not. The entire gene panel as such is studied, and they would tell you if you are at a higher risk of a particular cancer, so you can be placed on surveillance from a much younger age. The other risk factors are hormonal risk factors, such as reproductive characteristics. Women, when they attain menarche or when they start their periods under the age of 12, or if they attain menopause above the age of 55, they are at a higher risk of breast cancer. Those women who did not have children through their lifetime, of course, are at a higher risk of breast cancer. Late age of first pregnancy, above the age of 35. These are generally the reproductive characteristics which lead to breast cancer. So why does this happen? Basically, what happens is throughout your lifetime, you are increasing, there is a certain amount of estrogen exposure that your breasts have. So all these factors, such as late, during your, I'll re-explain. So when you have your cycles, what happens is that there is a peak of estrogen before every cycle. When by attaining late menarche or early menopause, you're cutting short those estrogen exposure through your lifetime. Even while having children, or when you're pregnant, you don't have your cycle. So again, that's cutting down the estrogen exposure. When you breastfeed, sometimes you don't get your cycles back after you give birth for quite a couple of months. So even then, you're reducing the estrogen exposure to your body. Hence, all those are meant to be protective factors. However, this is more of theory rather than practicality, because I have seen many patients in my practice who had 5 kids or 6 kids and breastfed each one of them 2 to 3 years. This was, women in the 60s or 70s at this point. They still do end up getting breast cancer. So although we don't have 100% evidence that these are absolutely going to protect you, you should be smart about reproductive age and your timeline. The other risk factors are exogenous hormones. Postmenopausal women, more so in the West compared to our country, they tend to get onto hormone replacement therapy, which especially the combined ones, which have both estrogen and progesterone, which definitely put you on a higher risk of breast cancer because you're literally feeding your breast the estrogen that it should not get. And oral contraceptive pills, we do not have level 1 evidence for this, but they do have a certain higher risk of getting breast cancer at some point, depending on how many years you take these oral contraceptive pills for. So if you are already at a higher risk of breast cancer, you'd rather think of other barrier methods of contraception. The most important factor today leading to breast cancer is lifestyle. Most of the women, especially in the postmenopausal age group, should be extremely careful because even though the periods, stop and the ovaries stop functioning, the estrogen comes up from the peripheral fat. As a woman's BMI increases, all that peripheral fat gets converted into estrogen and it attacks your breast. And with recent urbanization and westernization of our diet, we have so much carbohydrate, high fatty diet, low fiber diet, sedentary. We've gotten used to a sedentary lifestyle, lesser fruit, vegetable, increased red meat, increased alcohol intake, especially during the lockdown, and women of a higher socioeconomic status. Unfortunately, all these lead to a very, very different lifestyle, and they are high risk factors, which again are modifiable. Okay, these are the non-modifiable risk factors again. The race and ethnicity. Obviously, we can't really do anything about them. Women who are white generally are at a higher risk of breast cancer compared to Caucasians, Asians, etc. And Black women, although there's no increased, they don't have a high risk of getting breast cancer. If they do attain breast cancer, it's very, very aggressive in them. The other risk factor is benign breast conditions. Now, this is completely medical. There are certain lesions in the breast, which are known as hyperplasia, which put you at a higher risk of breast cancer at a later stage. So what I want you to take back from this point is, if, God forbid, you ever have to go for a mammogram and get detected with something, they do a small excision biopsy or they perform a small surgery on you, and then they say, okay, fine, it's not cancerous. What you should ask them, especially postmenopausal women, are, what is this lesion? Does this lesion put me at a higher risk of breast cancer in the future? Because based on that, the surveillance generally changes. Previous chest irradiation, generally younger girls and boys, for example, they have any cancers in thyroid, the neck, the lungs, etc. They might get radiation, which puts the breast under a higher risk of breast cancer in the later stages. So now that you know the risk factors, what are the screening techniques? We have three main tools: breast self-examination, which is something that you have to do for yourselves every month; clinical breast examination, which is basically what we would do on you when you come to visit us, any healthcare professional; and mammogram. Although the US Preventive Services Task Force recommendations say biennial mammography from the age of 50, that is every 2 years, let's talk about the Indian scenario. We have conducted many studies in big centers such as Tata Memorial Hospital and Adyar Cancer Institute, etc., which they have shown that breast cancer predominantly occurs between the age groups of 40 and 49. But mammography in our country has shown to be effective based on studies only in the postmenopausal patients, which is about the age of 50. So obviously we cannot use this as a standard of screening in our country, not only because of the study aspects of it, also because we don't have resources to reach out to every woman in rural India or urban India. So, which is why breast self-examination and clinical breast examination are the best methods for early detection in our country. The main steps of breast self-examination. Now, this is something that every woman has to do every month. For a premenopausal woman, at the end of your menstrual cycle, wait for 2 to 3 days after the cycle ends and then examine your breast. For a postmenopausal woman, any one day of the month. Choose that day and make sure you repeat the same procedure on the same day the month after as well. So breast self-examination, there are 2 steps to this. One is looking, and second is to feel. On the selected day, just get into your bathroom, undress yourself, look into a mirror with the arms by your side. Look for any visible swellings, visible fullness, any skin changes. Is your nipple pulled inside? You can also place your arms on your hips and just push into your hips. Sometimes any skin changes become more evident on the breast. Raise your arms above the head. In this way, the undersurface of the breast is not missed, and the outer aspect and the armpits are generally not missed, which are very, very important components of breast self-examination. And also, if there are any visible skin changes such as dimpling or puckering, raising your arms above the head make it more obvious, because if there is a lump, the lump stays stationary inside the breast, whereas the skin, it moves on top of it. So that makes it even more visible. The second step is to feel. Lie down on a bed, place a pillow behind your head, place your hand behind your neck, and with using the soft pad of your opposite hand, 3 fingers, the middle 3 fingers, just examine your breast either in concentric motions, out to in, or up to down and side to side. Although I prefer the circular motion, it's totally up to you. You have to examine your breast from the collarbone to the middle of the chest, under surface of the breast, the outer aspect of the breast, and the armpit. Of course, if you're going in concentric circles, you will come to your nipple, but do not forget to examine your nipple because it's extremely important. Some women prefer doing this in the shower as it's easier to feel. The skin is easier to feel at that point. This is a small video on breast self-examination, which might help you.
Let's get started. Step 1. Stand in front of the mirror and check your breasts for the changes, including change in your breast size or shape, thickening of the skin in the breast or underarm area, swelling, warmth, redness or darkening of the breasts, dimpling or puckering of the breast skin, an itchy, scaly sore or rash on the nipple, pulling in of your nipple or another part of your breast, or pain in one part of the breast. Step 2. Now raise your hands and look under your breasts for the same changes. Also feel for lumps or hardness in this area. Step 3. Next, check your nipples for any discharge or fluid secretion. Nipple discharge may be watery, milky, yellowish, or even tinged with blood and should be checked immediately. Step 4. Lie down on a firm surface on your back and using slow circular motions, feel your breasts for any kind of lump. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of the breast. Check the inner part of your armpit as well. Always use opposite hands to check the breast. Step 5. Stand up and repeat the same circular motions from step 4 across each breast. Step 6. If you detect anything suspicious in either of these steps, don't panic. Make a note of your findings and schedule an appointment with your doctor immediately. If everything seems okay, you can be at ease. But remember to conduct this examination every month. But do keep in mind that you do it after your periods are over. Those who are not menstruating can do it on an assigned date every month. Remember, cancer is not the end of the world. In most cases, women who are diagnosed with breast cancer survive and lead healthy lives, especially when detected in time. Keep your date with your gynecologist or breast cancer specialist for an annual preventive breast exam. Early detection is the key. Be informed. Let's get started.
So I hope that was informative enough. So the signs to look out for: swelling or fullness of the breast, breast lumps, which look like this, axillary lumps, that is lumps in the armpit, nipple inversion, discharge or crusting, skin thickening or redness, change in the size or shape of the breast. There are certain factors or certain signs that you have to look out for, which are extremely important because these are nothing but advanced cases of cancer, which might mimic other kinds of benign diseases. The first one is something called pudorrange. Imagine an orange peel and imagine your skin becoming exactly like that. That is a red flag. Inflammatory breast cancer. Now, around 0.5 to 2% of all the cases present with something called inflammatory breast cancer, which mimics an infection. The entire breast becomes hard, warm, heavy, red, and it rapidly grows. So when you go with such a symptom to a doctor, sometimes they might be confused and start you on antibiotics. Remember, if the antibiotics are not reducing the signs or the symptoms, please make sure that you are evaluated properly with the mammogram and ultrasound, or reach out to an oncologist or a breast specialist, because they would clearly be able to make out the difference and it might necessitate a biopsy. This is another picture of a patient with inflammatory breast cancer. And earlier in the presentation, I talked about crusting of the nipple. Now, sometimes with minimal medication or steroids, if this condition of crusting of the nipple does not decrease, you have to suspect something called Paget's disease of the nipple, which may look like this, and the entire nipple generally is destroyed. We have to do a biopsy and take it forward. Also be aware that most breast cancers, especially in the early stages, are asymptomatic, so they might be found only on a mammogram. Although it is good news for the patient, as it is early, you might miss it if you don't get a mammogram, and it might just advance to LABC, which is locally advanced breast cancer or metastatic breast cancer. And very rarely you do get symptoms of in ipsilateral arm swelling. That is, because breast cancer spreads to the armpit nodes as the first station, you might get a swelling there, which you might ignore, but that particular node might impinge on the lymphatics, which carry the fluids in the arm, and it might block it, in turn causing an entire arm to be swollen up. That might be the initial presentation at times. And very rarely does the person present with something called metastatic symptoms. The breast cancer, what you should know here is breast cancer spreads to the bone, lung, liver, and brain. So if it spreads to any of these organs, you might end up with symptoms such as bone pains, fracture, neurological deficit, breathlessness, cough, pain in the abdomen, lump in the abdomen, anorexia, or jaundice. And all these are nothing but symptoms in the advanced stages of breast cancer. So how do we diagnose this condition? If you have a clinically palpable lump, make sure that every one of you, whoever has a lump, or if you know anyone who has a lump, make sure that they undergo a triple assessment, which is clinical examination done by the doctor, a bilateral mammography, which is an imaging, especially for those above the age of 40. They generally tend to do an ultrasound for those under the age of 40. And a biopsy has to be done with it. Clinical breast examination is done by the doctor when they reach the clinic. Mammography is basically placement of the breast between two plates and from top to bottom and side to side. And then people generally get scared to get a mammogram because of pain and radiation exposure. But the pain that you endure for 1 to 2 minutes might actually be a lot lesser than the benefits that you might get from a mammography. And radiation exposure, it's quite minimal, and it is authorized by it's in standards. When you do a mammogram, these are the images that you end up getting. And for example, if you can see this little lump here, this is what we detect. Make sure a biopsy is done based on what your doctor suggests to give you a final diagnosis. So pathology is basically done. That is, the diagnosis is basically given to you either by a fine needle aspiration cytology, which is a needle being pricked into the lesion, and they take a little bit of an aspirate or fluid and send it for analysis. And a cord biopsy is basically when you put a gun-like structure into the lesion and take multiple shots at it. Just to give you a brief about the different modalities of treatment in breast cancer as such. Local regional therapy is just the breast. It's surgery and radiotherapy. Radiotherapy is just current or light therapy or X-rays that are directed at the breast to kill the cells, the cancerous cells. And systemic therapy, remember breast cancer is a systemic disease, so you have to attack even the system by using chemotherapy, hormone therapy, or something called targeted therapy, depending on what is driving the tumor. Also remember that breast cancer is not the job of just a breast surgeon or a medical oncologist, but it has multiple people involved: a breast surgeon, a radiation oncologist, medical oncologist, that's who gives you a chemotherapy and hormone therapy, a pathologist who gives you the diagnosis. Radiologist, in my view, is the most important person and my personal best friend. Also a physiotherapist, a nutritionist, and counselors are extremely important for complete management of the patient. Back in the day when breast surgery started, it used to be quite massive. The entire breast had to be removed with the underlying muscles as well, and it used to be a massacre. But currently, with the advances, we have not only come to preserve the breast, but now we can do oncoplastic work, which is basically reconstruction, focusing on the quality of life. And if if the cancer actually spreads to the armpit nodes, we don't have to completely clear the armpit for oncological clearance. There are other procedures such as sentinel node biopsy or axillary sampling that have proven to be oncologically safe as well. This is a quick note on breast conservation surgery. The patient had a tumor here. It was removed, obviously keeping in mind that there's no other lesion anywhere else in the breast. Now, if you opt for a breast conservation surgery, make sure that you will get radiation to the breast and sometimes to the bed of the tumor as well. Only then it is oncologically equivalent to removal of the whole breast. Now, psychological effects of a woman. Unfortunately, when the woman is diagnosed with breast cancer, she may undergo many, many changes. She might be scared. She might be in shock. She might be angry, disbelief, relief that she was diagnosed at an early stage, anxiety, depressed, numb. You don't know what the patient actually goes through. Some people actually might express in the clinic. Some people might need time to go back home, digest the news, and then come back to us. So it's very important to give them time to digest the diagnosis. And in my practice, what I have seen, it was always helpful having someone else in the clinic, which could be their partner, their family, someone from the family, or your friend. And give the patient time to go back or take some time to go back, understand everything, and come back. And for the women, obviously she needs time to digest the news. And she should always have a one-point contact, which can be either the doctor herself, the breast care nurse, or any one expert in this field to answer questions at any point in time. It completely depends on her if she wants to tell her family or friends. And unfortunately, she has a lot of stress, anxiety, mood swings, depression. They feel there is a loss of identity and feeling isolated. Every woman reacts differently. So we have to individualize every woman and go accordingly. The coping mechanisms for the patient to manage stress and anxiety, you can distract them. There's relaxation, mindfulness, and meditation, one-on-one counseling with a therapist, and something called cognitive behavioral therapy, which is basically dealing with what is going on at the moment instead of bringing the past matters into the current situation. How to deal with the current situation is called cognitive behavioral therapy. And physical activities such as yoga has proved to be helpful. Obviously, she goes through depression, so there are multiple antidepressants that can be given to them. But what really is hard for the patient is life after treatment, life after she undergoes the entire treatment array. Will the cancer come back? Whom do I talk to? She might live in fear of the cancer coming back at any point of time. It's very important for them to talk to someone and let it all out. What can you or I do to help the patient? Obviously, support is extremely important. And more important is do not treat her as a patient. And as for yourself, do not be overburdened as a carer. You have to take care of yourself as well. Give her space. Bring in family and friends to make sure that the environment is very positive. You can encourage physical activity. Observe as a carer or as someone in the family member, observe what she's going through, record it and ask questions, note them down, ask the doctor or ask the one-point contact. Understand the disease and her mood swings. Obviously, positive reaffirmation is extremely important, but obviously none of this is easy. Diet and breast cancer. We really can't say that these particular foods will prevent breast cancer as such, but they have shown to be somewhat protective, although we don't have level 1 evidence. Preventive methods of breast cancer sometimes can be having a good, wholesome diet, which includes 5 portions of fruit and vegetables a day, whole grains such as oats, brown rice, couscous, or quinoa, certain amount of beans, pulses, fish, meat, eggs, and other proteins should be a part of your diet. Fats should be less than 30%. And you should try and include at least 2 portions of fish a week, especially the oily ones, which are, for example, like salmon and mackerel. Dairy and alternatives. Of course, you can have them, but try to choose the ones with low sugar and low fat content. Limit alcohol to around 14 units per week and try to do it on 3 non-consecutive days. Avoid salty food and sugary foods. Avoid saturated oils and spreads. Try to go towards avocado oil or olive oil. And phytoestrogens. Soya milk, tofu, etc., linseed oil, all of them have estrogens, the phytoestrogens, which basically mimic the estrogen in your body, but they are consuming them is proven to be safe in limited quantities. And superfoods such as berries, raspberries, blueberries, green tea, and broccoli have shown to be protective, and that's what the breast cancer patient generally is advised to have. But also remember that nobody has to stick to this diet because they obviously are going through a lot of other emotions in their system. So, but these might help having a better outlook towards the lifestyle. The possible strategies for primary prevention is, or risk reduction is quit smoking, start exercising, especially in the postmenopausal age group, limit alcohol intake, stop menopausal medications such as hormone replacement therapy. Breastfeeding is proven to be protective. Early pregnancies, avoid long-term use of estrogens, avoid adult weight gain, 5 servings of fruit or vegetables a day. Like I've mentioned, substitute your oils with olive oil, avocado oil, etc. And more than 3 hours of physical exercise every week. That could be just brisk walking, has shown to be protective. Again, limit alcohol. And the most important aspect is clinical breast examination from the age of 40, along with a mammogram done every year. You reach out to the doctor, get examined, and also get a mammogram done every year from the age of 40. And from the age of 25, make sure you are aware of your breasts and you examine your breasts on a monthly basis. Of course, breast awareness means understanding what exactly your breasts look like so you can understand when something goes wrong. So towards the end, the common myths and misconceptions. The myth is finding a lump in your breast means you have breast cancer. That is not true. Like I've mentioned, around 8 out of 10 breast lumps are absolutely benign. Unfortunately, in our country, so many women stay away from medical care. 1, because they fear what they might find, or 2, they get so engrossed in their day-to-day activities of being a mother or being a carer of the house, so they neglect their own health. I had patients coming to me in the past saying, I have my daughter's wedding, so can I get this treatment done in the past? I have my brother's wedding, which is why I didn't come to you earlier. And then there are other set of women who are in their early 30s or in the 30s, generally younger women who come to me with a lump, well, relatively in the advanced stages, and say, I did not want to tell you anything because my husband wanted me to have a baby. That is absolutely absurd. So please take charge of your own health by monthly self-examinations and regular visits to the doctor and regularly scheduled mammograms. The other myth is men do not get breast cancer. Again, not true. Men do get a condition, develop a condition known as gynecomastia, which is enlargement of both the breasts. And this generally happens because of hormonal imbalances, alcoholism, the liver gets affected, and multiple other aspects in the breast. And they also get breast cancer. Although it accounts to only 1%, when breast cancer occurs in men, it's extremely aggressive and tends to be detected late. Hence, the prognosis is pretty bad. Having a family history of breast cancer means you will get breast cancer. It's a myth. When you are diagnosed with a particular gene, which it makes you more prone to getting breast or ovarian cancer, around 40 to 80%, but it does not mean you will absolutely get breast cancer. However, if you have a mother, daughter, sister, granddaughter who had breast cancer, you should have a mammogram 5 years before the age of their diagnosis and make sure you reach out to a genetic counselor. The other common myth, which I was asked just day before yesterday, is breast cancer is a communicable disease. So this patient asked me, I have breast cancer, I'm going back home, I have grandchildren. Can they drink from the same glass? Can I touch them? Obviously, it's not contagious. It's not a communicable disease. Breast cancer cannot be caught from someone else's body. It occurs because it's an uncontrolled cell growth in their own body because of multiple factors. And lastly, surgery for breast cancer means removal of the whole breast. Again, not true. Multiple trials have shown that breast conservation surgery is equally safe and effective as mastectomy. And today with oncoplasty, the results are excellent and we can improve the person's quality of life as well. So this concludes my talk. If you have any queries, please feel free to reach out to me. Thank you.
Thank you, Dr. Pragnya. You brought home so many plain truths. Ignorance is never bliss. And this is a classic case, I think, where detection should begin with us. There are quite a few questions waiting for you. And for the first one, we will go to Chairperson Usharani Manne.
Hi, Pragnya. Thank you so much. And I think actually I have written so many questions, but you answered all the questions. Presentation. I know you have already answered for this question also, but again I'm asking because once my gynecologist advised me to take a mammogram only once in 5 years after the age of 55. So is that the right approach?
No, absolutely not. Current guidelines say that from the age of 40 onwards, these are the NCCN guidelines, if anyone wants to refer, you have to get a clinical examination from the age of 40, which is what, when you reach out to a doctor, what we would do for you, and a mammogram annually. This is only if you're at an average risk, which is when you don't have a family history of breast or ovarian cancer. But if you have a higher risk of breast cancer, it's a completely different picture. A genetic counselor can give you what exactly you have to go through and at what intervals. So, but if you're at an average risk from the age of 40 every year until the age of 75, and after that, there are no recommendations. It depends on the person's will.
Thank you so much. That's, the entire presentation is really an eye-opener. And let me also congratulate you for that informative talk. And it was actually very positive in the approach. And it's always encouraging to know that recovery is possible.
Absolutely. I'm glad you got the positive message at the end of the talk.
Yes, yeah. Now I will give it to Priya to handle question and answers.
Yeah. So there's a question from Prashanti and Ritu. They're asking if padded bras and underwire bras have any impact on us contracting breast cancer.
No. They unfortunately, underwire bras sometimes might lead to infections, but not cancer. Infections only because there's constant friction at the undersurface of the breast, but not cancer.
Okay, so that's good news, Prashanti and Ritu, you can go for it. And Vandana is asking, does tightness in the breast indicate any signal? And if there is a lump in your armpit, could it be fat accumulated? And how actually would you feel the pain in the armpit if you have cancer?
Okay, that's a lot of detail answering to this. But okay, so to answer the first question, swelling in the armpit can be either a node, which is relatively a lot deeper. And if a woman is generally on the higher, a little chubbier, then it's tough to examine yourself. So that's where you can reach out to a doctor to assess the node. Having said that, if sometimes women might have superficial swelling, which is nothing but fatty tissue, or sometimes accessory breast tissue, because sometimes during the development during childhood, there's a certain amount of breast tissue that might remain in the armpit that begins to hurt during your menstrual cycle and becomes larger. So that is nothing to worry about. It just happens cyclically, as long as it happens only during your cycle. And what was the other question, Priya?
Just a minute, give me 1 minute. Yeah. If there is a lump in your armpit, could it be fat accumulated? And how actually would you feel the pain?
It's basically some sort of pricking kind of pain, or if you can recall during your premenstrual syndrome, when your breasts become extremely heavy, engorged, and painful. That's the kind of pain that you might have even in that area if it's accessory breast tissue. So sometimes it can be pricking, it can be pulling, or it might feel warm. There are different kinds of pain, and every woman honestly goes through different symptoms. Whereas when it comes to a node, again, there's no specific kind of a pain unless it's extremely large. Then it feels heavy in your armpit. But otherwise, it's just generally the kind of pain you experience on a monthly basis.
Thank you. Tejaswini Yarlagadda is asking, could you please elaborate on the safeguards one needs to take with early menarche kids as they are in the higher risk category?
They don't generally have to come under, just because a person attained menarche at like maybe 9 or 10, it doesn't necessarily put them at a higher risk of breast cancer. It increases the estrogen exposure through your life. So all that I would suggest is that have a good lifestyle, make sure you're not on the have to have a good diet. All these, in fact, lifestyle factors and reproductive factors, and in fact, more they help you more towards preventing breast cancer rather than just that one factor of menarche, because it's not in your hands.
Okay.
I hope that answers your question.
Yes, and what about the side effects of the various treatments, be it medicines, radiation, chemo, maybe hormone therapy, or even targeted therapy?
So each one of them have different side effects. Chemotherapy, again, it depends on what kind of medicine. For example, there's something called anthracyclines and something called taxanes, which are completely medical, so I'm not going to get into it. But each drug have their own side effects, which might range from generalized tiredness, hair loss, your immunity goes down, so you're more prone to infections. And if you come to the aspect of radiation, they have other side effects such as ulceration. Your skin becomes dark because a lot of X-rays going and attacking your skin, generalized fatigability. And when it comes to hormone therapy, it depends on what hormones you're taking. For example, tamoxifen is a very commonly used drug in breast cancer and precancerous lesions, which the most common side effect of that is blood clots in your legs and endometrial cancer. Obviously, if you're starting on tamoxifen, your doctor will be able to tell you how to take it and what side effects to look out for. Other hormonal medication can cause weakening of knees, joint pains, etc. So in targeted therapy, again, each one of these modalities have different side effects. And sometimes they might all be combined, but the most common side effect in my practice is generalized fatigability and more prone to infections. So because your immunity obviously decreases, and loss of hair.
Thank you. And will the treatment and condition affect one's chances of having a baby? And what if it is detected during pregnancy?
That's a very good question. So during pregnancy or 1 year after pregnancy is called pregnancy-associated breast cancer. Now, it's a very, very challenging situation even for us to detect because one, we can't do a mammogram during pregnancy unless it's absolutely required. And so we have to take the necessary precautions like shielding the baby from the radiation. So not only is the diagnosis hard, but the treatment is also hard because we can't give all these different kinds of treatment throughout pregnancy. We can only start chemotherapy in the second, the third trimester. We can only start radiation after the entire pregnancy is done. Surgery we can perform surgery at any point. So unfortunately, sometimes if a young woman earlier on in her pregnancy develops a cancer, we even might ask her to terminate her pregnancy because obviously her life is more important. So that's pregnancy-associated breast cancer. Unfortunately, it does have a relatively poorer prognosis compared to any other woman.
Thank you so much. And there's one last question. How is life after recovery? Generally, how should it be?
Every woman has they face different realities. Every woman has a lot of symptoms and feelings that they go through. They have feelings of isolation. Sometimes they don't know what to do. They don't know how to get back into reality and continue their lifestyle. So in my practice, I've seen patients on two ends of the spectrum. One is they're very, very positive and they go ahead with life. And if they have any symptoms, they deal with it at that point of time. They're very vigilant and they become volunteers. They make sure everyone knows what breast cancer is. And sometimes they're very happy to tell people that they had breast cancer, they are survivors. Whereas on the other hand, again, women find it extremely tough to get out of it. So it affects them mentally, physically, it affects their relationships. So I think at that point, the family needs to come into the picture and they need to give all sorts of positive reaffirmation that's required.
Okay. Well, that's a lot to understand and digest for one day, but then it's been so informative. And ladies, I think we all should hurry up and definitely schedule those annual health checks that we've been ignoring. We can't, I think, take the excuse of time or, busy schedules and all that. I think we just should go and should get it done. And we know where to go to if we have any issue now. Thank you, Dr. Pragnya, for answering all those questions so patiently despite that long talk that you did.
My pleasure.
And over now, sorry, I interrupted you.
No, my pleasure. Thank you for having me.
Over now to Uma Chigurupati, our Senior Vice Chairperson, for the vote of thanks.
A very good afternoon. That's a very enlightening, informative, and useful session. Eat healthy, stay active, avoid stress, be positive, enjoy what you are doing, and get regular health checkups. Those are a few take-homes from this session. We all know that good health is true wealth. To keep the body in good health is our duty. There is this famous quote that says, women's health needs to be front and center. It often is not, but needs to be. Good health is. Sorry? Okay. If you check the health of a woman, you check the health of a society. We all know that women are into multitasking. They give priority to family, their well-being, their happiness, and many more aspects, but often don't give priority to their own health and well-being. There is a lot of importance being given on breast cancer awareness in recent times. Why? The main reason being, we just saw the statistics and growing numbers in the presentation today. Awareness about breast cancer is incredibly important as early detection can be most treatable. This awareness is to reduce the stigma, educate us on symptoms, early diagnosis, and the state of art of the treatment options available. Thank you so much, Pragnya. Past 45 minutes is packed with such valuable information, and we will definitely follow your advice and precautions given. On behalf of the committee and members of FLO Hyderabad chapter, once again, thank you very much.
Welcome, Mom.
Our gratitude to the gold sponsors Polman Group, event partners Indo-US Specialty Hospital, RBC Worldwide, our event partners, Pushpam Publications, our gifting partners. I thank all our past chairs, all the members of FLO and other viewers who attended the program today. I congratulate the team who worked very hard and brought in this awareness program and the technical team for all their support. Before I close, I would like to mention that your health is an investment, not an expense. Your attention is very much needed, and your health is 100% your responsibility. Take care of it. Thank you so much.
Thank you, Uma. Members, all right. Members, for more such valuable sessions, do subscribe and follow our social media pages on Facebook, Insta, YouTube, LinkedIn, and Twitter. Before we see you all on 30th at our Game Changers session, please take part in the Think Pink campaign that Usha spoke about during her speech. Until then, be aware, be prepared, and pick up the phone to schedule that long overdue health check today. Can we have the closing slides, please?
ఇండో-యుఎస్ సూపర్ స్పెషాలిటీ హాస్పిటల్ అమీర్పేట హైదరాబాద్ అత్యాధునిక సౌకర్యాలతో అపారమైన అనుభవం కలిగి సుశిక్షితులైన వైద్య బృందంచే జనరల్ చికిత్సలు, శస్త్రచికిత్సలు అందిస్తూ ఉన్నత శ్రేణి ప్రమాణాలు, సౌకర్యాలు కలిగి సామాన్య మధ్యతరగతి వారికి కూడా అంకిత భావంతో వైద్య సేవలు అందిస్తుంది ఇండో యుఎస్ సూపర్ స్పెషాలిటీ హాస్పిటల్ లేటెస్ట్ టెక్నాలజీతో కూడిన ల్యాబ్లు, ఆపరేషన్ థియేటర్లు కలిగి అన్ని వ్యాధులకు అన్ని వైద్య విభాగాలు కలిగి పేరు ప్రఖ్యాతులు కలిగిన హాస్పిటల్ ఇండో యుఎస్ సూపర్ స్పెషాలిటీ హాస్పిటల్.
Namaste. Thank you very much for joining us here.